I'm Chris Beyrer, I'm the Center Director, and just before we begin this session today, I do want to acknowledge that it's Veterans Day and want to thank all the veterans for their service and think about the challenges people in so many armed conflicts all over the world are facing today. So we've been doing these events since 2004 when we started the center, so it's 15 years. We used to say that we had survived 5 years, so we did not have an early childhood loss of life. Now I think we're in our adolescence, 15 years out. And I have to say that I can't remember a time where public health and human rights issues have been more relevant. So today's theme, what we're going to be talking about today, is what we're calling the new normal. And the new normal is about the reality that in our current global situation, so many threats to human rights and to human health are transnational in nature. They're not contained in one country or in one population. And all you really have to do is think about either COVID-19, which of course is shaping the way we're all interacting here, and climate change, which of course the Glasgow meeting is underway, it ends tomorrow. They are absolutely transnational threats to health and well-being. They have enormous human rights dimensions. And what we've seen, unfortunately, is that a lot of our human rights paradigm, our laws and regulations are really not engaging and up to the task of addressing these transnational threats. And so that's why we thought we should really be talking about transnational issues today. And I'm delighted to say that we have some people who really have been working on those interfaces. You're going to hear from an environmental lawyer working on many of the climate change issues, an anthropologist working on refugee and migration issues, an epidemiologist working on rights and justice issues in multiple countries. I'm going to introduce all the panelists when we get to that part of the program. But let me just say that all of these issues bring together really what are some of the most challenging concerns that we face. And they're also ones that we can't escape, right? We have seen, for example, with the COVID vaccine rollout, that the inequalities and the injustices and the exclusion of populations is threatening to undermine our whole global response and to continue to drive this pandemic. Climate change also completely inescapable. So last year, for the first time, as you may know, a third of Americans directly experienced a climate change-related threat to health. Right? That is a huge proportion, either flooding or fires or air quality pollution issues, powerful storms, just an array of climate change threats. And of course, we know very clearly, again, that climate change has this extraordinary injustice. The people who are the most vulnerable to climate change, the bottom billionth of the world's population, have contributed the least to carbon and really are suffering disproportionately because of what the wealthy countries, the industrialized countries, have done to the global environment. And so it immediately becomes a social justice issue. There was a panelist yesterday at the climate change conference from Bangladesh who was saying the climate crisis at its heart is a moral crisis. Right? It is at its heart a human rights crisis as well. And that is why we really think that human rights framing is so important to think about it. All of us, all four of the people you're going to hear from today, including myself, have tried to take this on with a new International AIDS Society Lancet Commission on the future of global health that we hope to have out for the next International AIDS Conference, which will be in July in Montreal, Canada. And we've been working hard on these issues. And the transnational challenges and threats are really what has emerged in doing this work together for this Lancet piece. And so that's really what we wanted to bring today. So we're delighted to be joined by some real experts in the field. Lilianne Fan, who's going to be the first person to speak to you today, is an anthropologist. She works on refugees and migrant issues, both in Kuala Lumpur, Malaysia, where she's based, but also in Banda Aceh in Indonesia. She is the international director and co-founder of the Geutanyoë Foundation, which is a regional humanitarian organization. She chairs the Asia Pacific Refugee Rights Network's Rohingya working group, and she's been working a great deal on the Rohingya population, which, as you may know, have been considered now to be the most marginalized and discriminated population on planet Earth, which is, considering how badly things are going in so many places, a terrible distinction. She's also head of the Secretariat for the All-Party Parliamentary Group in Malaysia on refugee policy. So Lilianne, we're so delighted to have you, and I'm really looking forward to hearing, of course, refugees and migration as transnational an issue as you can get, right? And also, of course, a regional and global issue. Our next presenter will be Gerson Smoger. So Gerson is an environmental lawyer. He's a leading figure in environmental litigation. He heads up Smoger and Associates. And we serve together on the advisory committee for Physicians for Human Rights, which is how we got to know each other. He has tried cases and argued appeals across the US, multiple state Supreme Courts, and the US Supreme Court, specializing in consumer fraud, environmental litigation, childhood lead exposure, groundwater pollution, air contamination, and issues of global warming. So really somebody who has taken on the legal fight for the climate and for people affected by pollution. And then lastly, our own Stefan Baral. Steph, as many of you know, is an associate professor of epidemiology here at the Bloomberg School. He heads up our program in key populations in the center. He's been doing extraordinary work in Canada during COVID with homeless populations and with outbreaks, and looking at the human rights and social justice issues around COVID responses, but also, of course, has done a great deal of work with marginalized populations all over the world, in particular on that interface of LGBT rights and health, which he's really made extraordinary contributions. So I'm going to start off. Each of our presenters will give a brief talk about their work and their ideas in these transnational challenges, and then we'll have an exchange, and hopefully we'll have an exchange with all of you. So Lilianne, over to you.
Thank you so much, Chris. I'm really honored to be part of this symposium, although I'm on the other side of the world, and I think it's also very nice to have this transnational connection in line with the theme of our discussion today. I would like to talk about the issue of global displacement, and then focus really on two contemporary crises. One is the crisis of the Rohingya, but the other one is also looking a little bit at the challenges that Afghans are facing now, both inside Afghanistan as well as in the external displacement context. And I think the first thing we need to talk about when we think about displacement and refugees, and particularly in the context of conflict and persecution, it's that, you know, the main threat that results in displacement and that results in refugee flows is actually usually not transnational by nature. It's actually the lack of protection nationally. The fact that civilians, you know, citizens of a country, or in the case of the Rohingya, people who are not recognized as citizens of a country but are in a country and are denied human rights, are not able to get protection from their governments or access to basic are facing such dire human rights challenges that, in fact, they need to flee to be able to seek protection outside. And that's where, you know, the situation of refugees obviously is a transnational one, but the crisis actually starts nationally and very much locally as well. And I think that's something really important to understand. So I wanted to begin just by painting a picture for everyone. You know, many of you might know these figures already, but I think it's important to situate the contemporary crises in the sort of global picture. By the end of 2020, we actually had more than 82.4 million people worldwide who were forcibly displaced. And that's as a result of many different types of challenges, including war, persecution, violence, various types of human rights violations. And there's basically been a very steady increase in the number of persons forcibly displaced around the world for many years now, at least for a decade. We've far surpassed the number of displacement that we saw during World War II. That happened a few years ago, where we basically crossed that threshold. And even with the COVID-19 pandemic, where we've seen increasing difficulty for people who are trying to seek international protection and seek asylum, this hasn't stopped the rise in the number of people who've been forcibly displaced. And in fact, we saw an increase even between 2019 and 2020. We saw that we currently have 1 in 95 people of the world's population who are now forcibly displaced. And this compares to, 10 years ago, we had 1 in 159 people who were forcibly displaced. So we're actually really rapidly increasing in terms of our displacement rates globally. And that's really important to understand. I think the second important thing to understand is that, who are these displaced persons and who is actually hosting them? So while refugees and asylum seekers actually originate from a very wide diversity of countries, there's really just a handful of countries that contribute to the majority of refugees and asylum seekers. Syria still tops the list with 6.8 million refugees and asylum seekers worldwide. Venezuela now is number 2 with 4.9 million. So that's, in your hemisphere, your continent, which is really extremely worrying as well. Afghanistan is now number 3, and that's of course increasing beyond, 3 million or so, and particularly with, the current political crisis as well. There've been very large numbers of Afghans who've been obviously displaced internally, but really also fleeing the borders, to various countries. There was just a report by the Norwegian Refugee Council just yesterday that around 300,000 Afghans have newly arrived in Iran. And that's just one country that's receiving, Afghan refugees currently as a result of the current crisis. Myanmar, of course, in my region, that's another country which obviously has been producing many, many refugees. And it's not just the Rohingya, it's many different groups. For a long time as well, we've had many ethnic minorities from Myanmar who've been in conflict with the Tatmadaw, the Myanmar military. But of course now as well, as a result of the coup from earlier this year, we've also seen increased numbers of displacements, both internally as well as people who are crossing borders. South Sudan has about 2 million asylum seekers and refugees. And then you have countries like DRC, Somalia, Eritrea, who are also contributing to the global refugee and asylum seeker pool. But those are not, by any means, that's not an exhaustive list, but that does contribute to the majority. I think the second thing, to understand is, where are they? I mean, who's actually hosting them? I think if you're looking at it, from my angle, where I'm sitting in a developing country, in a country which is a middle-income country, where we haven't signed the Refugee Convention, where we complain about, refugees all the time, even though our numbers are quite small. It's important to understand that actually 86% of refugees worldwide are hosted in developing countries. So the issue of lack of legal frameworks for countries which are actually hosting the majority of populations, this is a real issue. There are countries, obviously, like the US. The US has traditionally been the largest resettlement country in the world, and there's a whole history to that. That goes back obviously to Indochina. But even with the recent cuts, and of course now the increase with your current administration, the US continues to be the first country in terms of resettlement. But resettlement countries really do count still for a very small percentage, just about 14% of basically hosting refugees worldwide. 73% of refugees are actually hosted in countries that are neighboring the countries of origin. So that's important to understand as well in terms of geographically where people are. And if we look at basically who are displaced, most persons who are fleeing from their countries are between the age of 18 and 59, and I think that's not too surprising. Knowing that those are probably the more able-bodied persons, where it's easier to travel and cross the border with all the challenges that exist. But there's actually an equal number of males and females who are crossing borders, and 26.4 million refugees and asylum seekers are under the age of 18. So that's really important to understand as well. Now I'd like to talk a little bit about the Rohingya crisis. So the Rohingya crisis is not a new problem. It's really one which has a very long history to it. I won't have time to go into the details of that, but there's lots of good literature that's been written up on the history. But in a nutshell, basically, that it's the result of a really systematic and protracted denial of human rights for this population in Myanmar, a denial of citizenship or pathways to nationality, basically taking the Rohingya off the official list of recognized ethnic groups, which Myanmar recognizes to have the right to citizenship under their 1982 citizenship law. And then a series of local orders in Rakhine State, where the Rohingya originate from, which have restricted movement. There's basically very limited freedom of movement, has restricted access to basic services, including healthcare, including education, restrictions on marriage and family life, and have subjected the Rohingya basically to really extensive forms of abuse, arbitrary arrest. There's, of course, claims of genocide as well, and that's currently being, debated at the international courts. The ICJ, Gambia has taken up a case against Myanmar with the charge of genocide, and this is all, taking place right now. But there've been extensive abuses, and I think it's also fair to say that currently, with the conditions in Myanmar under the coup, the wider population is also becoming more aware of the impact of the impunity of the Myanmar military, and the fact that the Rohingya have been perhaps the most visible victims of this impunity for a long period of time. But of course, now the entire population of Myanmar is exposed to the same kind of similar types of violence as well, even if they do still have that basic citizenship right. But in August 2017, we basically saw a real increase in displacement from Rakhine State of the Rohingya. And that's because of very brutal mass atrocities that were taking place against them in Rakhine State, which caused an additional 700,000 or so Rohingya to flee across the border into Bangladesh. And currently the largest refugee camp in the world is Kutupalong, which is in the Cox's Bazar district of Bangladesh. And there were already about 300,000 Rohingya refugees living in Bangladesh for many decades. In fact, the years of protracted displacement. But in addition to that, you now had this new population that started coming in 2017. And you can just imagine the levels of deprivation, in spite of the fact that the Bangladesh government gave access to territory and actually very remarkably allowed for so many people to cross the border and still allow them to reside in Bangladesh, and has allowed access to international assistance as well as local Bangladeshi organizations to provide assistance, humanitarian assistance to the Rohingya. The scale is just overwhelming. It's incredibly overwhelming. I mean, you have major health problems, that continue to prevail in these refugee camps. The conditions are overcrowded. It's sprawling. The camps are absolutely sprawling. I've been there numerous times before COVID. And it's actually really shocking, even for somebody like me who's been working on refugees and asylum seekers and have been to many refugee camps around the world. There's really nothing like the situation in Bangladesh. At this point, it's even worse than the conditions in Dadaab in Kenya. And what you can see is, it's not only the conditions in the camp itself, but it's the fact that there's been such a long-standing denial of access to healthcare, even in Myanmar. So people are coming in to Bangladesh, with basically that history as well of just absolute denial, to proper healthcare, already a lot of complications, and then the violence, the trauma, and the very difficult conditions inside the Bangladesh camp, which have led to a lot of acute diseases, malnutrition, which was still a big problem until recently, I think, in the camps. And I think it's a little bit more under control now, but you saw a very high malnutrition, and you still see that in northern Rakhine State in particular. A lot of Rohingya women, of course, were also victims of sexual violence. And that, of course, also led to a lot of PTSD, depression, a lot of complications as well in terms of maternal health. So that's a little snapshot of the Rohingya situation in Cox's Bazar. The Rohingya are not only in Cox's Bazar, they're also spread, around many different countries, including in this region. In Malaysia, we have an estimated 150,000 or so. It's probably higher than that, but there are still many who are undocumented, who don't have UNHCR documents. The other little snapshot I wanted to give you was quickly on the Taliban impact on health in Afghanistan. And this is basically to say that, in the last few months since the fall of the Taliban, you've really seen an already weak health system collapse even further. You had a lot of doctors and health professionals who have been part of this pool of people who've been trying to flee the country because they've been so terrified of the Taliban. And those who've stayed, the Taliban has been unable to pay the salaries of doctors and health workers for the past 3 months. And it literally, the UN had to step in with $8 million just a few days ago to pay the salaries of 23,000 or so health workers without the cooperation of the Taliban. So it is a very complicated situation. The Taliban has also already said that they're against house-to-house vaccinations, and they'll only allow vaccinations in certain types of places under certain types of conditions. The economic conditions have obviously collapsed as well. There's increasing poverty and hunger, and people don't have the resources, to even go for basic treatment. There are a lot of concerns, obviously, as well, of basically the situation of women. I think this is something which many of us are monitoring as well. But there's a lot of violence that's happening quietly. And I think, there's a huge problem of underreporting of sexual violence that's taking place right now because people are really scared. We hear a lot of these cases from our staff because with my organization, Geutanyoë Foundation in Malaysia, we're staffed entirely by refugees besides myself. I'm the minority in the organization, the only one who's never been forcibly displaced. But our Afghan colleagues in the organization are very closely monitoring the situation. And on a day-to-day basis, we get reports, even from relatives of Afghan refugees who are here in Malaysia, about cases of direct violence that's taking place and an absolute fear of reporting these incidents in any way. So that's also an enormous concern. Even in countries like Malaysia, where we don't have a refugee law, but we do have a recognition that there are people in need of protection. So we have sort of ad hoc protection for certain groups, and we tolerate refugees to be here. And as long as they have a UNHCR card, there's some level of tolerance and agreement by the authorities not to arrest and detain people. It's still extremely challenging for many reasons. Even in Malaysia, we've got a slightly, probably one of the better policies that Malaysia has come up with for refugees and asylum seekers has been to allow a 50% discount for public health facilities, so for government clinics and hospitals, a 50% discount off the foreigner's rate of healthcare. But because we don't have a comprehensive law that actually grants rights to refugees, we still don't allow refugees to work legally. And that means that for refugees and asylum seekers, even who have a UNHCR card or a letter documentation that can get them that 50% discount, they are still burdened by the cost of payment, because the foreigner's rate is much, much higher than the rate that I would pay as a local. So it's basically to give you the example of, even when you have countries that sort of welcome some of these populations, and Malaysia has been quite sympathetic to particularly the case of the Rohingya for a long time. It's still an enormous challenge because we don't have laws. And I think what's really important here is, how do we strengthen the frameworks that have emerged globally? We have now the Global Compact on Migration and the Global Compact on Refugees. These were meant to guide countries who have not yet become signatory to the Refugee Convention, and to guide them in working much more in partnership with international partners, and even with different stakeholders at the national level, private sector, civil society. We're very far away from recognizing that. And I think it's really a matter of urgency to be able to step up in those discussions and have really pragmatic conversations, particularly at a time when, partly due to COVID, but partly also due basically to political trends, there's been such a fortification in the rhetoric of national security, and asylum seekers and refugees are really suffering from this. I'll stop there, Chris. Thank you.
Well, thank you so much, Lilianne, and such critically important issues. Are we going to applaud? Go ahead. Yes. I hope you can hear that. I think, when we think about displacement, it is now also going to be so hugely affected by climate change. And so many of the most fragile countries politically are also fragile environmentally. So Gerson, I think we'd love to hear from you on some of the transnational and rights issues related to climate change. It's a kind of a natural flow from what Lilianne has shared.
Can you hear me now?
Yes.
Okay. Yeah, let me start. When we think of climate change, what do we think of? We think of higher seas, decreased ice in the Arctic, melting glaciers, extreme rainfall variability, and more frequent and intense storms. And every time or in California where I am now, fires. And we talk about the events of climate change, but not the human rights effects of climate change. And we're going to start with the premise that human populations have centered themselves on locations based on water transportation. So if we look at where human population centers are, they're most often on coasts or on interior waterways, where there was an ability for transportation going back into the earlier period before we had an area of jet travel or automobile travel. So they were already established. This means that these tensions are on the water, and this is exactly the system that is most affected by the increased rains and the traumatic events and the storms. So I'm not going to discuss a different issue of drought and desertification and land but I am going to talk about land degradation, and also on these coastal areas, which are prime for both transportation and for our agricultural resources. There's massive saltwater intrusion as the change. We think about water, but we don't think about the fact that salt water is intruding on the coast. This relates to tensions over food, and there's coming and starting to be a land rush for the available land as more land is made unstable, unusable. There's also a characteristic, and I think we talked the Rohingya and other populations. There's armed conflict. There's a study that was done that 23% of armed conflict that are in ethnically fractionalized societies, and this was by Schleusner, that was initiated, or before that there was some climate change or some environmental event. And it wasn't that the environmental event caused it, but the reality is that the environmental event destabilizes an area to make it more likely to make the resources more scarce or to increase. And at its extreme, we're talking about societal disintegration. Now, who are most effective? We know, I think Chris already said, the marginalized people are more likely to live in areas most at risk of climate change. Most, the most difficult areas next to the river, or in coastal areas that are in floodplains. That's where the most marginalized are likely to live. Now, I want to talk in specific about two marginalized populations, and that's because of my the speakers that came before me and after me. And the first is the Rohingya and Myanmar. I'm going to go back actually before the crisis, before 2017, and go back to 2018 and go around 200 miles south in the Irrawaddy Delta and in Myanmar. And the Irrawaddy Delta, forget it, we forget now that there was a cyclone Nargis. Cyclone Nargis caused 140,000 deaths with 55,000 people missing and displaced 2.5 million. That was, we're talking about only 200 miles away. In Rakhine State, which is a low-lying region susceptible to cyclones as well, off the Bay of Bengal, floods, landslides, saltwater intrusion. Cyclone Giri in 2010 left 70,000 homeless. In terms of food and the scarcity of food, which I mentioned before, 7.1 million tons of rice was lost to heavy rain. 2015, again before 2017 event, Rakhine State was hit by severe floods, which resulted in declaring of natural disaster zone. I think Chris mentioned that, and I think Lilianne mentioned, when in these instances, then you have an increased outbreak of malaria, waterborne diseases, and that renders the entire population, more vulnerable and is more likely to get into the situation of competition over land and to stir up underlying long existing ethnic problems. So we get to the Rohingya being forced to Bangladesh. So what came quickly when that happened? You take this large population that's emigrating, and they need shelters and fuel. That it becomes largest refugee camp in the world. Estimates of 1.2 million people in the refugee camps. When you consider what was Lilianne talked about, the already existing people there with the people that came after 2017. I have a slide that I don't know if anybody can that be seen? Okay. So now this is Kutupalong, and that's a overhead of what the refugee camp that was going to come around looked like in 2017 before the movement and the push out of the Rohingya from Rakhine State. And now look at them just a year later of what happened to that environmental area. So you have massive deforestation. There was a need for shelter. The wood was cut down. There was need for fuel. And then you have massive environmental concerns that we don't really think about. We have land degradation, which is incredibly dangerous. The removal of trees, decreased and unstable. There's soft hills and the soft soil. So there's an increased threat of landslides. There's the cyclones. I mean, this is a cyclone-prone area that's already prone to flooding, and it's affected also by the increased loss of the glaciers in the Himalayas, and directly increased by water, by the effects of the rising bay. 1/4. Now let's look at Bangladesh, because now they've moved into Bangladesh, and look at that from a climate perspective. 1/4 of Bangladesh is less than 7 feet above sea level. This This is gradually salt waters being pushed into coastal agricultural areas, and there's massive coastal erosion. In addition, the Intergovernmental Panel on Climate Change predicts Bangladesh will lose 30% of its food production by 2050. We have to consider this as in the total review of what we're looking at. We can't, the isolation of climate change integrates this, and the refugee populations, the migrant populations, displaced populations are always given the worst, most difficult to live in areas because that's the areas that have been that have populations have allowed them to go into, and we've got a long-term problem. Now, I said I wanted to talk about two things because the speaker, now my next speaker has done a lot of work. The next speaker after me has done a lot of work in LGBTQ rights, and we don't think of that often in terms of climate change, but we should be talking about that in terms of the reaction to climate events or dangerous emergencies, and what happens in those emergencies as a marginalized population. Trans people, especially trans people of color, face heightened suffering at all stages of natural disasters, which are becoming more frequent. During Hurricane Katrina, lesbian, gay, and trans people faced discrimination routinely in emergency shelters. And it took 10 years for some, particularly the African American gay population, to rekindle itself after Hurricane Katrina. If we look internationally, a lot of shelters are run by religious organizations that are strongly opposed to much less gay rights, but to the mere existence of being gay, the mere existence, and particularly trans. And they're either shunted from the shelters or the least benefit, citizens least benefit. And then that exacerbates also in our displacement scenarios because there's trouble crossing borders and to escaping conflict. So there's more trouble. There's much more difficulty for lesbian, gay, and our LGBTQ people to face that and to change borders in an international system. And these are reactions to environmental catastrophes. So that we're going to have one after another after another. We're going to have flooding events. We're going to have there's massive events of the cyclones or the hurricanes here, and there's got to be movement, but the movement is restricted for LGBTQ people. So if you have this, so you can't, so there's difficulty getting safe housing. There's difficulty of getting foreign services, particularly in developing countries where gay sex may even be a crime. Now, I wanted to point out that very recently, to emphasize this, just a few days ago, on November 8th, the Federal Emergency Management Agency warned that lesbian, gay, bisexual, and transgender people are, quote, more likely than others to be severely impacted by disasters and may need extra help. That has never been part of the statements before, and they noted that LGBTQ people have been historically socially repressed and excluded, and that after a disaster, LGBTQ people are more likely to be socially isolated and face disrespect or harassment in settings or shelters as the resources are limited. So I wanted to give two examples, hopefully pertinent to the people I'm speaking with, that related to marginalized populations and the worry. And that's not answers, but we always we spend so much time talking about the problem in terms of what can happen in terms of the weather or water or storms, but not the human tragedy that is coming. Thank you, Chris.
Thanks, Gerson. That was very powerful. Really. Steph, you want to come here? Great.
Great. Yeah, thanks. It's funny being back speaking in person. I feel like it's like riding a bike. Like we're starting small, and then we'll grow from here. So, I mean, I think it's interesting. I think it was really helpful coming after these two speakers, because I think today's session, it's not a lot of good news to talk about. I think that we are in a time where like grave violations just don't have the airspace. People don't, I think, have the bandwidth to sort of like process what is happening around the world right now. We don't hear in the media a lot of discussion like we heard about Afghanistan, but even just in reviewing the last few months, it's very difficult to even find any stories about what's happened in Afghanistan since US pulled out, which is fascinating because we know that's just the beginning of when these crises emerge, as Lilianne just shared with us. I think I want to, I think as I was listening, I felt like I'm going to just use 5 minutes to think about like, what does it mean moving forward? Because I've given a lot of thought over the last 18 months about the lack of space, about talking about sort of like nuanced rights issues, whether it be the freedom of assembly, the freedom of press, limits of police powers. These are difficult to talk about in the context of public health emergencies, but I think as we think about like what our pandemic responses, need to think about in the future, or what we need to sort of integrate into these policies, are not only the need to address, marginalized communities as central to any pandemic, because pandemics obviously don't affect everybody the same. That I think is central at this point, and it's been a fair amount of what I've spent my time trying to document empirically over the last couple of years. But I think it's to sort of not only to center marginalization and disparities into pandemic responses, and especially in the context of emergencies, but also to find a way to not lose track of like dynamics happening outside of our own spaces, because people's worlds have become very small. I mean, by definition, like social distancing is such that like your world is to become small. But I think in that, when you lose context about what is happening really far away from you, we lose the ability to engage in it. We lose the ability to to bring voice to it, and ultimately to respond to it. Because I think in some way with rights issues that are happening a world away, advocacy can be a very powerful tool, like empiric research, study, but at some point, and obviously direct service delivery in as much as one can, but also really advocacy and ensuring that people are aware of what's happening. And I would venture to say that very few people are aware about what's happening around the world right now, whether it be rights issues. As a personal anecdote, just talking about the climate crisis, I was in Senegal a few weeks ago, so we started getting our travel legs and work back under us. And I'll say that I went with my friend Dauda outside of Dakar to this beach which has completely been deserted. And it was all like, it was prime land that, generations had been built on in Toubab Jalal, about 40 minutes from Dakar, but it's been completely just left behind because the water has come up so high that flooding happens so often that people just can't live there anymore. And the land is worthless at that point, and they just had to literally leave their land and lost that sort of generational wealth that happens with land, with owning land. Last week I was in South Africa, where with Sheree Schwartz, we work a fair bit on trying to address the needs of sex workers. And the amount of sexual violence and physical violence affecting sex workers in the last few years has been astounding. And it's not covered in the media in South Africa. A few years ago it was. There was really a call to attention about the need to decriminalize sex work, about create safe spaces for sex workers. But again, in the last few years, there's just not been the space to talk about it. But in the context of curfews, sex workers have been at grave risk, and there's been pure impunity. And obviously not limited to South Africa. I mean, many of us know the tragic story in the UK with Sarah Everhart being attacked by a police officer and killed, raped and killed by a police officer. And even at the protest, to protest that violence, there was more violence by police in terms of shutting down protests. So I think, like, what do some of these things mean? Because it's hard to sort of, I was thinking our team, we wanted, like, we don't just lay out problems, we sort of, like, what are some of the implications of this? I think one is, in people's minds, the term global health security has dramatically changed in the last year and a half. It's gone from a term that used to be about, like, our collective ability to improve the health and well-being of all, and thus ensure security, to really something about protecting our borders or protecting it. It feels like the general narrative around it has changed, and I think we need to fight to change that back. I think we need to reclaim that term. I think in terms of the work that we're doing with the Lancet, it's also fundamental that even as the US government, and obviously the Trump administration had a real attack on, like, sexual health and reproductive rights, like the term rights as in obviously the access to contraception, access to abortion. That term was not allowed under the Trump administration, and there was the Protecting Life and Global Health Assistance Act that many of you may know about, but basically it disallowed any engagement with any contraception writ large with any USAID or any US government dollar. Kind of amazing, which has now gone away. But what's interesting is that when you talk to, like, the field offices, the sort of rhetoric around being able to engage back in the rights discussion about sexual health has not changed. And we've not seen that sort of dramatic shift, even though there's been a quiet removal of some of the kind of legal and policy barriers. We've not seen that same shift back to really focusing rights as being central in terms of improving access to again, these central services. So, I think that, like, so what does it mean? I think that, like, as the language of pandemic responses moves forward, I think we really have to think about how we can encourage folks to be able to talk about human rights as central to those. I think that we have to reclaim this language around global health security. We have to fight for the R in sexual health and reproductive health and rights to go back in there, because it has been removed, and again, it hasn't come back. And I think we just need to make sure that we are documenting this, bringing attention to it. And we're a small group here today, but I think to try to, really have these discussions, which are difficult to have with people right now, even in the context of vaccines and boosters in some places and no first doses in other places. It is central that we center these conversations around rights, because I think we've always known this, there can be no public health and well-being in the absence of respecting rights. And you can't have good health and you can't secure rights in the absence of health. And the two are so dramatically interlinked. And while it wasn't, I will bring this back to Chris's opening, which wasn't on the recording, is to say that I don't think there's ever been a time when bringing attention to public health and human rights has been so central and so important to document and share and discuss and bring attention to. So I hope we do that today. I hope we build on that, but I'll finish there and hopefully we can still have some conversation. Thanks.
Well, we had some questions for the panelists, but given how much time we have left, we'd just love to hear from you and open this up. And please, if you have a question or a comment for any of the three speakers, just also let us know who that is. But please, Cherie, and welcome back.
I don't know that I have the greatest articulation for this question, but just to say, one of the things that I kept thinking about during all of the talks is this issue of fear and how fear motivates us. And it can motivate us to do bad things, and it can motivate us to do good things. And sometimes we try and use fear to motivate people to do good things, but it can swing the other way. And I just wonder how you are all thinking about that and trying to leverage or diminish that in terms of your work to sort of amplify the cause. If that makes sense.
So Gerson and Lilianne, if you didn't hear, Cherie was asking a question about hearing all three talks, thinking about fear and the way that fear is motivating so many responses, both maybe potentially harmful ones, potentially helpful ones. I think that is really a function of this particular moment. And it certainly is the case that it can be disempowering, right? And we want that not to happen. I wonder. Does anybody want?
I could respond a bit to that, Chris. It's a really great issue to bring up. And I think that, I think about this all the time in my work, because we basically are dealing with populations who are in a position where they need to weigh different types of fear. And we also see that responses from authorities who try to, prevent arrivals, basically, of what they call undocumented persons or illegal migrants, which of course include many asylum seekers and people seeking international protection. The trend has been towards deterrence. And, this entire policy of deterrence, trying to basically scare people with arrest and detention, with prosecution, and other forms of, punitive measures. It's really, these are really fear tactics. But I think that we were talking about this with UNHCR and other colleagues the other day, but there really needs to be some evidence of the fact that these policies don't work. People flee because of push factors. Yeah. That's really the ultimate driving, motivator of why people leave. It's because they can't survive under their current conditions, whether it's Rakhine or Afghanistan or Somalia. And whatever types of measures you put in place, people will find a way to get around them. And in fact, what it results in is strengthening of smuggling networks, the emergence of other forms of non-legal pathways, because the legal pathways have been shut off. So it is really important to consider that. And as an anthropologist, I think it's such a fascinating question as well. And but it is really something that we see. Refugees are stuck between the fear of, being returned to a place that they've fled from, and a fear of basically living on a daily basis as an undocumented person, right, in countries where there's no refugee legal frameworks. Fear of detention, but they'd rather be, the majority of them, I would say, that we've spoken to, they'd rather be at risk in a country where they're at risk of detention and arrest, rather than being in a country where they're at risk of being killed directly. So it's really, you're between very, very difficult choices. And ultimately, the fear tactics they're not going to stop people from fleeing and trying to find protection.
Yeah. And maybe I'll just jump in. And I think the other side of it is sort of the use of fear indeed to motivate vaccination or social distancing. And I think what worries me, I think it's similarly, it's worthwhile to sort of study this empirically, because I don't think there's great evidence for fear in terms of as a long-term viable solution to motivate healthy, empowering practices. I think we've kind of been through this before, and folks like Julia Marcus and others have been trying to bring back some lessons from a long time ago about, that as a communication strategy. I also just worry that we're opening up the long-term game of it is it's an interesting dynamic, because speaking about refugees and immigration is that, while we've talked about sort of creating fear of the unvaccinated and COVID-19, you see Ted Cruz blaming people coming from Mexico for COVID-19 outbreaks in Texas, which is fundamentally untrue. There was higher cases in not folks who hadn't immigrated or who hadn't crossed the border. But we open up pathways for folks just to turn from fear to anxiety to anger to blame. And we kind of let our governments off without addressing what are fundamental barriers, because most people want to be healthy. And, then there's the extreme, but catering to the extreme is never that helpful. I think catering to the vast majority of folks, we can do that with empowerment and education and resources. So my thought is I don't think it's also an empiric approach, even if it feels good for the people doing the fear or just doing the messaging, it's almost endorphin releasing to say something aggressive to folks. I don't think that it's necessarily that impactful. And I similarly worry about like where it takes us a few years from now as it relates to completely disconnected, unrelated health issues that we've kind of created an opening that I worry about. So.
If we have a second, I agree. We just looked at both ends of it. There's a positive end of it, and I'm not.
Yeah, we hear you. We hear you, Gerson.
Okay.
Go ahead.
There's a positive end of it, and there's the negative. We use fear. We condone the use of fear for what we perceive as positive ends, and then we categorize as problematic the use of fear by what we perceive as negative ends. And then the question is individual fear, or is it fear into social groups? I don't know that we have a good answer for that question, and I'm going to morph into an answer that I was going to give to one of Chris's other questions, which is disinformation, and the problem of that on the internet, since I just hosted a 2-day symposium on that. How do we deal with the fact of the need for privacy rights as against free expression and fears of censorship, and at the same time worries about disinformation? They counter each other, and there's no good solution that we have. So you've asked a question that I don't know that we have a good solution for. I can go into something else in terms of how it's manipulated and how fear is manipulated, which is what we're worried about. And we're worried about fear as a result of disinformation, which I think we're going to talk about. But I don't think we have clarity to your question.
Yeah. Well, we haven't gotten time to get into disinformation and misinformation, which is, of course, a huge issue. I will just say that even Facebook has admitted that the Facebook platform was used to help launch the Rohingya genocide. So that is the clearest example of the use of that kind of platform to stoke fear about a minority and about an ethnic group, and to convince the majority population that these people were a threat to them and to their well-being. So I just want to end by saying, first of all, I want to thank all three of these wonderful speakers, and please join me in thanking them again, if you would. I want to say we haven't had time to really explore what we're all going to do about this, but that is coming. We are going to keep this conversation going. In the Lancet series, we're interrogating interventions that we think might make a difference using modeling. There's several different groups working on modeling different aspects. What would a more equitous COVID-19 response look like in terms of achieving epidemic control? What would it look like to really be able to understand more about the way disinformation is undermining health and human rights globally? There's a number of elements to this. Also looking at, from the sex worker perspective, at changes in policing and policing practices and what that might do to reduce violence, for example, and reduce disease transmission. So stay tuned. We're going to continue this work. For those of you who are new to Hopkins or new to the Center for Public Health and Human Rights, let me welcome you again. As Steph said, it's kind of baby steps starting, coming together, but it's wonderful to be with you all. And I know these are really challenging issues to grapple with, but here we are in 2021. This is our world, and it is a place that is just fraught with the interaction of health and human rights. That is for sure. And I would say that everybody going forward, all of you with your careers in public health, these are just inescapable realities, and they're going to play an ever-increasing role in what we all try and do to improve human flourishing and protect people's rights. So thanks again, and thanks to you, Jenny, for organizing as always, doing a great job. And to the people who are with us online, thank you for your attention, staying with us, and hopefully we'll all be together maybe by the time of our spring event. Let's see. All right. Thanks.